Welcome to North Star Physical Therapy Podcast. I'm Dr. Shirlea North, and with over a decade of clinical expertise in the areas of pelvic floor conditions, lymphatic conditions, and chronic neurological diseases, I have a wealth of medical knowledge that I want to share with you all. In this podcast, I will answer the most common questions I receive from clients, family members, and fellow clinicians. Our purpose is not only to answer questions, but to educate you so you can make the best decision for your optimal health. This podcast is perfect to listen on your way home from work, while you're on your daily walk, or just taking 15 to 20 minutes for yourself. Again, welcome to North Star Physical Therapy Podcast, and get ready for us to guide you to optimal health. Hello. For all those who are new to North Star Physical Therapy Podcast, thank you so much for joining us. For those that are return listeners, I thank you so much. Please like and subscribe and share this podcast to family and friends or on your social media platforms. It is so helpful just to get information out there. And so that is my passion doing this podcast. So I just thank you all so much for joining me today. So today's episode is going to be combining my two specialties within pelvic health and lymphatic health, specifically within the population of lipedema. Lipedema, as hopefully some of you have been listening or can go back to previous episodes and take a peek of what the heck lipedema is. I think it's going to be an ongoing conversation of really defining what that condition is and what the symptoms of it, and then subsequent symptoms that we find with those with lipedema, because I really feel like it's a connective tissue condition. And with that, we want to make sure we're treating holistically. So I really have a strong passion in this area because a lot of women, because it happens in women, or happens with those with a very estrogen dominant system, that there's often pelvic health conditions and symptoms related to that. If we take other populations like hypermobility, so those that really have really flexible joints or deemed double jointed, or those that have what's called POTS or Ehlers-Danlos syndrome or mast cell activation, or these other conditions that are starting to become more and more recognized within the medical field and more diagnosed. They all have a common underlying theme. We think there is a connective tissue condition that we don't really know why or how it's triggered, and therefore we're more so managing symptoms than figuring out like the cure for some of these things. But to not go down that rabbit hole, we're going to use this episode today to kind of help reason out my clinical program of lipedema. So within my program here, I treat very holistically. Those that come and see me typically haven't been formally diagnosed with lipedema. And even though as a physical therapist, I cannot medically diagnose, I help educate and give the signs and symptoms that are very common, but also help guide my clients into the right specialist on the medical side that can help formally diagnose that. Some people that come see me, they may think they have lipedema, but when we get down into their medical history and some further questioning, it's like, you know what, it's probably not that. And let's, rule out some other things. So that happens few and far between. It has occurred, but most y'all really do know your body really well. And you see all these things being posted on social media and online. And I love the fact that people come to me saying, hey, I saw these things. I don't know if it's me, but that's why you're here, to get a medical expert to help guide you in the right direction. And I'm the one that helps implement an individualized conservative management plan. So if you do seek surgical management of the lipedema, that you've already set your body up for success for post operation, healing. And for those that don't want to get a surgery, that's wonderful. We want to support that decision and to help get you the best management to optimize your health as much as possible and to help reduce that symptom as much as possible. There is no cure. We can't get rid of lipedema any other way other than surgery right now. So for those that have been placed on any kind of medication, like a GLP-1 or a GIP, those medications, and we'll do a further deep dive into that in a future podcast here soon, but they help manage the symptom of lipedema. And so the symptom has been significantly reduced or resolved so that they can be more active. But those medications will not dissolve that adipose tissue. They do not change the like they don't shrink it. They don't like fizzle it away. They help reduce the symptom that tissue is causing on the symptom. For example, like almost like an anti-inflammatory. So if things aren't as inflamed, they're not going to be as irritated. They're not going to be causing as much swelling. They're not going to be causing as much pain. They're going to be helping lymphatic flow, therefore reducing your symptoms, but you never really got rid of lipedema. So I think that can be a real miscommunication with providers, that we really need to make sure we're saying the right things to our clients, so that way they're not hopping on social media and be like, oh, I found the easy way out, or I found the magic pill. It does not exist yet, but more and more research is hopefully starting to happen, and we're learning more and more things. So who knows? I might have to redo this whole podcast in like 5 years and be like, you know what, y'all, I was wrong. But as of right now, that's the best that we know right now, is to surgically remove that tissue, and or symptom management, so that way someone can really optimize their health underneath, their lean muscle mass and all those things. But again, that will be a later podcast here very shortly, learning about what is the big hullabaloo in GLP-1 and GIP within this space and within pelvic health. So that's to come. This podcast is how I screen out for those things. So I treat very holistically. So it's more than just like a swollen legs or like swollen arms for within lipedema, right? We're treating any kind of pain management. We're doing the other conservative measures with compression garments, with mobility, with maybe manual lymphatic drainage, similar things, right? My one thing that sets me apart is the fact that I am a pelvic health therapist as well. And I know that oftentimes people with lipedema also are hypermobile, or they also are within the perimenopausal space or postmenopausal space. Some of my clients are also within the postpartum, or they're thinking about getting pregnant for the first time or again. And so we're utilizing my pelvic health, knowledge and skills to help guide them through this, so that way those events of like pregnancy doesn't exacerbate the lipedema symptoms. So I perform a pelvic floor or pelvic health screen to ask the questions about bladder health, bowel health, sexual health, pelvic pain, like things like that. And if any of those questions, ring true to you, and you're like, oh man, that happens too, then I continue and say, hey, let's take a deeper dive into those symptoms, because they can absolutely be related to your lipedema as well. So for example, if someone has some easily bruising, they feel really bloated and heavy within their pelvis, both legs can get swollen, but the left side more than the right. We want to help screen out any kind of vein issue. We want to help screen out any specific pelvic compression issue, as well as implement the appropriate conservative management with the appropriate, compression garment and mobility. But we also want to make sure we are checking out external and internal pelvis. Are there muscles that are very tight and compensating for the hyper mobile joints around the pelvis, like the hip, like the low back, like the SI joint. And so oftentimes I see people for more than just their swollen leg or, swollen pelvis, but I'm treating them for their pelvic health conditions. So that way they are really optimizing that mobility to help with the lymphatic flow, to help with the venous return, to help with the structural joint stability for injury prevention. And then if they are within the kind of peri-pregnancy space, to help them prepare for their pregnancy. And for some folks, I also have a pregnancy program being a pelvic health therapist. So I have seen a number of folks that I've seen them for their lipedema. I screened up for their pelvic health symptoms. We're working on that, and then they find out they're pregnant. Lovely. And so we kind of transition right into our pregnancy program, into our postpartum clinical program, and then kind of off we go. And along the way, because I am a cash-based provider, I am an out-of-network provider, I am never restricted by insurance limitations of how long I can see somebody in a treatment session, how many treatments I can see them for, what I cannot, what I can and cannot do within our treatment session. We're really able to explore everything. So I always tell my pelvic health folks to screen out for pelvic compression, and we're trying to change the vernacular to pelvic congestion syndrome, because not so much congestion, it's more of the vein is compressed, and that's what's reducing the venous return, and causing some swelling, not necessarily a congestion like in your nasal sinuses. It's not like an inflammation like that. So we're trying to change the vernacular a little bit to more of pelvic venous insufficiency versus pelvic congestion. But either way, right now they're a bit synonymous. But we're trying to help train and help educate pelvic health providers to screen out for those things, as well as on the other side have lymphedema therapists screen for lipedema and screen for pelvic health. And so I'm very unique where I see both in one roof, but oftentimes I get clients that have a pelvic floor issue, but they've gotten the conservative management from another therapist, or vice versa. They have already seen a pelvic health therapist and they need to, get screened out for any kind of pelvic congestion stuff. So the fact that I can do both for that same area in the pelvis is really unique and is really helpful for that. And so that's why I do virtual consultations for people across the country. That's why, I connect with other allied healthcare professionals and either other pelvic floor therapists and other lymphedema therapists. We all need to help each other for your optimal health. So if someone has lipedema, if someone has lymphedema, you need to be screened for pelvic floor conditions. It is a very easy thing that providers can do. I sometimes supply that screening tool to my other providers and say, hey, if any of these check boxes are checked off, you have them come see me and we can all work together. It's not like they have to stop seeing you. I don't want them to stop seeing you because we need to have multiple eyes and ears in the situation, but let's all work together to create a better, more well-rounded wellness program and optimal health program for these folks. So we want to make sure we're screening things out. I often get that complaint from my clients, and they wish their medical providers could be more well-rounded, could know more a little bit about everything. Quite frankly, that's really hard to do. Right? So we don't want to poo-poo our primary cares, our internal medicine, our general specialists, or general practitioners, that they didn't catch something. It's there's so much, the body is so complex, it is not in silos, but that's why there are specialists that dive deep into the research, that dive deep into that treatment. What is on those general practitioners is that they need to be able to network, to know who those people are, to send you to for that specialty, and to all work together to make that happen. So that is my role as a physical therapist at large, where it's like, hey, if there is, like, we're working on, your lymphatics, or I'm working with like a pelvic floor client, and I'm like, man, we are really kind of checking off the boxes. I'm doing all these things, working on the musculoskeletal system, working on their joint mobility, working on their strength, working on the flexibility, working on vagus nerve, helping to regulate that nervous system, working on biomechanics, working on hydration and some nutritional things. But if I find like, we're working on these things, but we're not quite hitting that symptom, or it's like we've made maybe some improvement, but not as much as I would think. Or someone is like, yeah, I just really still feel really pain, in my pelvis, especially on the left side when I'm sitting. And we've worked on all these things, and it's not quite hitting it. You know what? I'm going to have them go to a vein specialist and get that checked out, because it may be something medically that is beyond my scope of practice, but it's not beyond my scope to to refer out. And I will often do that. And I think that's really to the benefit of the client. And we're not giving up anything. We're just really screening for appropriate things. And ultimately, that gives the best results. That gives that optimal health. That gets somebody on a more individualized path. So any lymphedema or lipedema specialist out there, you should absolutely connect with your pelvic floor clinicians nearby to make sure you have a screening tool to screen out and put that as part of your programs. I'm giving a little tip there, because it is extremely helpful that if you are a pelvic floor therapist, to know that knowledge, or to communicate with your local lymph therapist, so that way we can all work together. I actually was just recently at a conference with all pelvic floor therapists, and my niche within pelvic health is knowing lymphatic health. And so I was just talking to one clinician from down in North Carolina, and we were talking about one client in particular. She's like, I'm doing this, I'm doing this, I'm doing this, but I still complain of these symptoms. I'm like, send them to a vein specialist, because I bet you it probably is a pelvic vein compression, but that is a very easy ultrasound to be performed. It will be a one-stop shop to get that answer for the client, so that way you're on the right, either you're on the right track and you have been, and it's a medical thing, or you need to switch gears within your treatment and be like, you know what, here you go. But that's why we use these diagnostics to our advantage, so we kind of know what's going on a little bit. Within physical therapy at large, we do not necessarily need a script or anything like that to see a client. That's why we have doctorates, in our as our degrees. We differentially diagnose, treatment wise, and we know, hey, this is probably stemming from a contributing factor from joints, ligaments, tendons, muscles, nerve compression, things like that, versus this might be a little bit more like a potential organ or a vein thing, and we need to get a specialist involved for that. So physical and occupational therapists are very good about collaborating with other medical folks. It's the other way around that we need to help out. But for the purposes of this podcast, I want you to understand that just because we have niches doesn't mean that we should just stay so narrow-minded. We need to make sure, yes, staying on top of the evidence-based practice, but we also need to stay on top of networking out and seeing who are the other providers that we can have in our back pocket to refer clients to for a more well-rounded approach. But we need to make sure we're creating clinical screening tools to do so. A lot of times you can look some up. There are great resources online with with the APTA, and sometimes you may have to just create your own a little bit. It may not necessarily have studies behind it, but you're like, hey, if you're asking there's this, it doesn't quite paint the clinical picture of a musculoskeletal issue, but it may be something else. But let me refer you back to your primary care. Or maybe I want you to have that discussion. If it was like my parent or my, sibling, I want you to make sure you're getting the best possible health. So as part of my lymphedema clinical program here at North Star Physical Therapy, I always perform a pelvic health screen within our sessions. So if anybody kind of triggers or says yes to some of these things, we flow right into a full pelvic floor evaluation, and which includes external to the pelvis exam, external pelvis exam, internal pelvis exam. We may also need to have those discussion education for any other medical team that might be needed to be a part of the care for those things too. Oftentimes my folks with lipedema, they also have some sort of urinary symptom. They often have some sort of hypermobility within joints. They often have some sort of pelvic pain also associated with it. They may also have some sort of other medical diagnoses that they've received or that maybe need to get further clarity on, something like endometriosis, PCOS, and so there's some sort of like hormonal health thing going on there as well. But as a pelvic floor therapist, you can absolutely treat those things conservatively, in addition to the medical management that they may need as well. So overall theme, lipedema and pelvic floor symptoms can go hand in hand. And it is absolute paramount that pelvic floor therapists need to screen for any kind of lymphatic condition, and any lymphatic therapist absolutely should screen for any pelvic floor symptom, and that we inter-refer for the benefit of a good individualized program for their client. And so if that rings true to you, or if you're not quite sure, if I have either one, feel free to contact me, check out my website, reach out. I do offer virtual consultations, so to kind of help ask those questions and, kind of problem solve with you a little bit to see if it's even like warranted to get a full evaluation, or if it's like, maybe kind of keep an eye on those things, or maybe, just to kind of help give some advocacy to you of what to discuss, with your providers to help you through your journey. We're all here together, and I thank you so much for listening, and until next time.
Thank you all so much for listening to North Star Physical Therapy Podcast. Continue to follow me on Facebook or Instagram at Dr. Shirlea North. Check out my website at www.northstardpt.com, or I encourage you to email me any other questions about these topics, and it can be featured at a future podcast at snorth@northstardpt.com. Again, thank you all so much, and thank you for letting North Star Physical Therapy be your guiding light to your optimal health.